Welcome to another episode of Let's Talk Health. I'm your host, Noxy Cameron. Today we are here to talk about cancer. And on this topic, I'm joined by a very special guest. May you introduce yourself?
Doreen Banda, nice actually.
So our first question is: when people say that someone has cancer, what does it what does the word cancer exactly mean?
Cancer is like the abnormal cells that are developed in the body of the person.
So when talking about cancer, how do people actually get cancer?
It's like that can be get by heredity.
Is this only way to get cancer, or are there any other ways?
It's like when you have got a wound,
Mm-hmm.
it's not taking long time to heal.
Yes.
It can develop cancer.
So can you tell us what are the symptoms of cancer, or how can someone suspect that they might have cancer?
Any type of cancer.
Yes, any type.
The symptoms.
Yes.
It's like, let's say like a breast cancer.
Yeah.
You have got a lump in a breast.
Yes.
Maybe it can be start with painless as time goes.
Yeah.
Then it can be pain, like hard, it can be hard to touch.
Oh.
Yeah. Like maybe the cervical cancer.
Yeah.
You have got a abnormal vaginal discharges. When not treated, it can be bleeding. Yeah. When after intercourse, then the person starts bleeding.
Yeah. So can you explain how many types of cancer that you know of?
Malignant and non-malignant. Yeah.
Can you explain flavor, like what are what type of cancer? What do you mean when you have what types of cancer? When you say you say malignant cancer.
Yeah, that maybe vice versa. I forgot it. But malignant, it can be the cancer that can be spread to other parts of the body. But non-malignant is that be static on the one part of the body.
So when we talk about cancer, there are like different types. There are like some say we have breast cancer. Some say we have lung cancer.
Yeah.
So can you explain how these types of cancer, how what actually happens when we have like these types of cancer? Like when someone has lung cancer, someone has breast cancer, someone has sometimes cancer can have brain cancer. So I just want an explanation of what happens on this type of cancer that you know, like brain cancer, lung cancer. What happens with some? What exactly happens to that person when they have this type of cancer? What happens to their bodies?
Okay, like lung cancer, the person may have difficulty in breathing because the lungs are affected. The lung is where gas exchange occurs. So it's the part that is where oxygen is exchanged. That's the person maybe having shortness of breath.
Oh, okay. You should have an So when women have breast cancer, what actually happens to them?
Breast cancer.
Yes.
Like I've already said that in the breast there is a lump, like a hard part of the inside the breast. As time goes, maybe it can be painless. As time goes, can be starting pain. Then after time they start reddish. Others they can be when not treated early. Even the breast can burst. Even they won't. That person.
So sometimes we hear that a patient has a tumor in their brain, so on how exactly does the tumor actually start inside the patient?
Not really know. But sometimes if the patient has a brain tumor, maybe we can see the symptoms. Maybe convulsions, loss of memory, can be the signs of brain tumor.
So sometimes I hear when people talk about cancer, they talk about stage 3, stage 5. So can you explain me what each of these stages actually mean?
Each type of cancer.
Though does that mean it cancer has different stages, or is it just I wonder? Most times I hear about this patient has stage 1 cancer or stage 5 cancer. So can you tell us more about what does it mean when you have when it's cancer at this stage, what does it mean? So when a person has cancer, what are the chances that we might live a long life, or what exactly do they have to do for them to live more after that body, to live for more years?
Okay. If the patient has been diagnosed with cancer and early treatment occurs, the patient may live long.
Can you tell us if you know any treatments for people with cancer?
Treatment.
Yes.
Like most of people undergo chemotherapy.
Yeah. So
Chemotherapy, it means they are I may be burning the abnormal cells with that chemical.
so chemotherapy is like chemicals.
Yeah, it's like chemo. Chemo means chemical. Yeah. They give medicine via the veins.
So do you know what these medicines are, or is it just in fair?
Oh, good.
Okay, do you know can you tell us the benefits and risks of cancer treatment?
The benefits.
Yes, of cancer treatment.
It may help the patient to live long. That can be the benefit. Yeah. Maybe it can reduce the spread of cancer to other parts of the body.
Do you know any side effects or risks for the cancer treatment might happen to the patient?
If the patient is receiving
It's usually cancer treatment.
treatment.
So any risks or side effects?
There are many side effects. Other may develop diarrhea, other constipation, nausea, vomiting.
Yes.
There's the side effects of treatment of cancer, like chemotherapy.
So when they develop the side effects, what normally happens to you?
Like vomiting, they give medication for vomiting. If constipation, they give medication for constipation.
So after giving medication, wait, so with the determination that you get take what medication for what side effects, or do they have any other type of cancer treatment to, but doesn't give, but doesn't affect your body? So when we test some cancer treatment can give him risk as having diarrhea. So
Yeah.
or after that, after giving him medicine, do you advise him to have another type of treatment, or can we just take the medicine?
Yeah, they consider, they weigh the risk.
So can you tell us what are other types of treatment if the reform that is not working or is affecting the body?
Oh, it's they remove the affected part.
Remove the what?
The affected part. Like if the cancer attacks the breast, they remove the breast. Maybe cervix, they remove the cervix.
So we've seen many patients that have cancer, they normally lose their hair. So can you tell me how exactly does this actually happen?
It's the medication that causes the person to lose hair. But I cannot explain what happens. But I just know it's the medication that makes the patient lose hair.
So when people start taking treatment for cancer, how long does the treatment usually take?
Like first, I don't, maybe they take others. They take 3 doses of chemo, then undergo surgery. Then after surgery, they continue with chemotherapy. Maybe in total, they can receive 8 doses of chemotherapy.
So from the first dose up to surgery, what is the accurate duration?
Duration? They receive 1 month, 1 dose, 1 month, then 1 month, then 1 month. So at 1 month interval.
So the surgery usually happens after like 3 months?
The surgery?
Yes.
They depend according to severity of the cancer. But what I say, they receive 3 doses. They undergo for surgical procedure. Then they continue making 8 doses. Then they give pills for a month. After that, they request to carry on. I think let it go.
Okay, when you are treating somebody from cancer, how are their daily lives or activities affected?
Maybe before giving the initiation of chemotherapy, you need to explain to the patient. Maybe the treatment will take long, so that the patient, if they have got fears, to reduce fear. Others, it takes according. Others, they respond well. Others not.
So when the patient has been treated for cancer, how do you know that the treatment is working?
Mostly, the best treatment is surgery. first they give chemo just to prevent the spread of that cancer. Then they go for surgery. That's the basic treatment. Yeah. After treatment, they continue with that chemo. So maybe they have just removed the part is remaining. That chemo will help us to kill the remaining parts.
Oh, after that surgery is removed, how do you know that the cancer has stopped spreading?
They take another sample for biopsy.
So we've seen some cases where they've been healed from cancer, and after maybe some months or years, the cancer returns. So how does this happen?
That's I stated earlier on that maybe when they were removing the cancerous part, they left other abdominal cells. That the cells that were left, they are the ones that spreading.
Okay, great. When the patients are getting treatment, what happens when if the treatment is not working?
For how long?
Especially like we've been taking the doses, but the cancer is still spreading. So what actually happens then?
Like I have one area on that. The best treatment is surgery.
Yes. So let's say somebody's saying surgery, but somehow the cancer is still spreading. So what happens when? Is there any other treatment, or can a baker told us you keep taking medicine?
Their treatment, they continue with chemotherapy.
Medicine is some of the treatment not working. Like chemotherapy is not working.
They undergo surgery. They undergo surgery. But chemotherapy is not the main treatment. Chemotherapy just helps to prevent the spreading of the cancer. But the basic treatment is surgery. They just remove the affected part.
Do you know any organization that help with this with people that have cancer?
There are many organizations, like in Queens. There's cancer center that deals with children that have got cancer. I don't know the real organizations that deal with cancers. Like the government. It's non-governmental. Government. I don't really know the organizations.
So out of all the patients, which group is the most vulnerable? Vulnerable to get cancer.
Which group?
Yes.
Like women's or people living with HIV. Or like elderlies.
So you say people living with HIV. So when someone has HIV and very restricted cancer, what exactly is happening in that person?
To get cancer?
Somebody already has HIV and then they tell that they find out when they also have cancer. So what if it happens to them or their bodies?
What effect?
What happens to their bodies? That Does the HIV accelerate or cancer accelerate?
Yeah, HIV accelerates because it weakens the body immunity.
So, does the cancer also accelerate or is it just HIV?
The cancer accelerates because of HIV. Because HIV reduces the immunity.
Okay, and you mean the body.
Yeah.
Okay. Thank you very much. Okay. This has been another episode of Let's Talk Health. I've been your host, Kam'mwamba, and I hope to see you all again.